One of the big controversies in thyroidology is whether some patients who don't feel back to the way they used to feel after they have a thyroidectomy or after radioactive iodine might benefit from T3 therapy in addition to the T4 or levothyroxine therapy that they're already on. And the reason that people are raising this issue is because normally T3 is the main thyroid hormone that actually regulates your metabolism. It's not T4. T4 has to be converted by your body into T3, and it's T3 that mediates all the metabolic functions of thyroid hormone. Now, in a normal person, 80% of all the T3 that comes about in your body every day comes about from the removal of an iodine atom from T4 to make T3. In fact, T4 is called T4 because it has 4 iodine atoms, and T3 is called T3 because it has 3. So your body removes 1 iodine from T4 to make T3. But about 20% of your T3 arises in your body every day from your thyroid. So if your thyroid has been removed, where does that other 20% come from that you're now missing? And the answer is it may not come from anywhere. In other words, your body doesn't automatically start increasing the deiodination of the T4 pill that you're taking now to make more T3. And it's been shown in many studies that after a total thyroidectomy, the T4 levels in the blood on your levothyroxine, when your TSH levels are normal, so you're like a normal person now, the free T4 levels are higher than they used to be preoperatively, and the T3 levels are lower than they used to be. So most people who take levothyroxine have a lower T3 than they did before they had their surgery. So in my own practice, if somebody has a thyroidectomy, let's say Dr. Morris Wiseman does a thyroidectomy on a patient and they come in to see me, their thyroid tests are completely normal now on their levothyroxine, and they are fatigued, they are, just not feeling exactly the way they did preoperatively. I don't have any problem trying T3 in such a patient. If we're going to do it, I prefer that the person be on levothyroxine plus T3, or it's called Cytomel is the brand name for that. It used to be that people who did that, like me, were considered, kind of crazy and outside the realm of medical practice. But now it's being more accepted. And so that's what I would try, but kind of as a therapeutic trial. I mean, I would say to the person, let's try this. If you don't feel any better in 3 to 6 months, then there's just no point in taking it. And honestly, in my experience, some people do feel better. Some people don't feel better. Some people feel better and then they don't feel better. Some people even feel worse because they develop hyperthyroid symptoms on it. So, but anyway, I think it's worth a try.